Hi everyone, and welcome to just a little mid-semester update from me. I just finished grading Learning Plan 5, which as you well know is on mental health, more specifically taking your mental health skills along with what we've learned so far about risk and protective factors, interventions, etc., and putting them to use with a case study with Tanya. Clearly we have a young lady who has a plethora of issues, not to mention a significant grief and loss trauma that she needs to work through as well. I really loved how you guys assessed her from a lot of different angles. Realized that this was a complicated case. Most of you had some similar approaches, but some of you really thought outside the box, and it was really, really awesome to see you guys kind of turn your wheels and think of what we could do as a mental health professional to work through Tanya's case. Overall, I thought you guys did a really nice job responding on the blackboards. I think you guys are doing a nice job there. I also really enjoyed some of the mental health diagnoses that you chose to pursue. My primary favorite always is PTSD, simply because I feel like it's something that so many people have experienced, so many people have worked through, and I also feel like it's an up-and-coming diagnosis in the sense that a lot of people are aware of it, a lot of people are starting to work through it, and a lot of people are providing evidence-based treatment for something that we used to not really understand before. We used to feel like something was wrong with somebody if they responded to trauma in that regard. And I also think we're really, really aware of what we can do to prevent PTSD. For example, responding to trauma immediately, helping them process and work through things. I really think that there's a level of intervention that needs to be applied when we're dealing with trauma in general, almost like a first response. And I know some places are working on that evidence-based treatment as well. I also really enjoy when we talk about anxiety and depression. I think those are diagnoses that are thrown around relatively easy without a lot of understanding, especially when we're talking about kids. It looks different in kids than it does in adults. So I think it's really, really great that you guys were able to talk through those and work through those. I always love some of the outside of the box ones too, some of the ones we don't talk about often, just because they're interesting. They don't necessarily apply to a lot of people, but I do think all of the mental health diagnoses are worth looking into and worth understanding how they look differently in children, because they certainly do. So hats off to you guys with that learning plan. We're jumping into interventions in Learning Plan 6, rounding the corner with child abuse and neglect, delinquency, and risky behaviors. So I just want to kind of give a little heads up that some of the most challenging topics that we're dealing with are coming around the corner. So kind of making sure you're taking care of yourself. We're definitely more than halfway through this semester, so be checking your grades on Blackboard. I'm always giving feedback on the discussion boards. If you're losing a lot of points on discussion boards, more than likely this is going to be a tough class for you to pull a passing grade in. So just make sure that you're responding the way that you should be, you're citing your sources, you're interacting with your peers the way you should be, because if you don't, you'll lose points, and there's really no way to make up those points. So touch base with me as always if you need to via email, phone, Blackboard, discussion board, whatever you need. I'm always here. But keep up the great work. I can't wait to jump into some more of the in-depth topics as we go. Have a great night.